Hey everybody, it's Dr. Cole. We're here in my living room and we're going to do another Ask Dr. Cole where people from my Facebook page or Twitter get to ask me their burning health question. And today's question is actually a very special question because it's from one of my oldest friends way back from high school, Alex. He is a stud, he is a genius, and let's see what Alex's health question is.
Hey, Dr. Cole. Man, that seriously makes me feel old. This is Alex Miller, your oldest high school journalism buddy. Hey, I have a health-related question for you. I've been working out a lot lately, and my question relates to protein. What is the proper amount I should be consuming? What sources are the best? And do you have any opinions on protein shakes or any type of protein supplement? Thanks, man.
Thanks for the question, man. My favorite part of that question was the awesome Kung Fu Ninja movie audio-visual delay. It was so awesome. I loved it. But seriously, that's a great question. I get asked a lot. Protein is hugely important. Protein and its amino acids are integral to our health. It's the building blocks of our body. Without protein, we would not be able to build muscle. But beyond just muscle, everybody knows that, protein is actually super important for every hormonal pathway in our body. We would not be able to live without it from that perspective. And it's also, another fun fact, it's a precursor to serotonin, to dopamine, these feel-good hormones, these neurotransmitters. Protein is a precursor to these. So without protein, without proper intake of protein, and without proper sources of protein, our body would not be functioning as optimally as it can. Protein, as with basically anything else in health, we need to look down to the individual and not sort of give very broad guidelines, because everybody's different, everybody has different nutritional needs. So we have to look at, in regards to protein, we have to look at such unique factors as things such as their age. If someone's older versus younger, they're going to need different protein amounts in their body. Their size. If some big dude, he's going to have different structural demands as far as protein is concerned versus somebody that's smaller. Also, someone's level of activity, if they're trying to build muscle or if they're just trying to just maintain their muscle, or if they're trying to lose weight, the protein amount that they're going to be consuming should be different, as well as somebody's level of health. If someone has kidney issues or liver issues, we have to take that into consideration to really tailor a health program down to that person's individual unique needs and goals. For the typical person, I normally recommend anywhere between 0.7 grams to 1 gram of protein per pound of lean body mass. And Alex, you're a math genius, so you can figure this out. And so if you're trying to maintain your muscle mass, I would stick to around 1 gram of protein per pound of lean body mass. And if you're trying to build muscle, you really probably could do a little bit more, maybe 1.5 grams of protein per pound of lean body mass. That should be sufficient. Now, this recommendation is by no means a high protein protocol for your diet, but it is a lot higher than the RDA that's normally given in the mainstream medical community, which I think is actually too low. Some numbers that I hear a lot from patients, conventional nutritionists or PCP, they're saying 0.3 grams of protein per pound of body weight. This is entirely too low. And they're also saying in the standard medical care to not have your protein intake exceed 20% of your diet. I do believe this is entirely too low, and I do believe it's ultimate a factor when we're seeing the rise of chronic disease and a rise of obesity in the United States, where we're spending so much of our percentages of our diets in carbs and a lot of processed foods versus really looking at clean, organic, good source proteins. Listen to this. Research out of London's Medical Research Council found that the typical Western diet is about 49% carbs and only about 16% protein. Again, this is completely imbalanced if we're trying to achieve optimal health. Research from the American Journal of Clinical Nutrition estimated that our ancient ancestors consumed about 45 to 55% protein out of their diet. And even in other research showed that tribal populations, modern tribal populations, normally consume the same amount of protein. About 45 to 55% of their diet is protein. Again, this is a lot higher than what the mainstream medical community is recommending people to consume. But look, our ancient ancestors, these modern day tribal populations, are not having these diseases of wealth, these chronic issues like diabetes, heart disease, thyroid issues, weight loss resistance, obesity. They are not having these problems. So we have to learn from this research to really look at how we can prevent these preventable diseases and reverse these diseases if we have them. Alex, the second part of your question is hugely important. It's paramount for people to really get, because not all protein sources are created equally. You do not want to go for conventional meat. You do not want to go towards conventional dairy. You're going to want to be picky about this and get organic meats, get grass-fed beef, get organic chicken, wild-caught fish, raw nuts, raw seeds. These are great sources of protein. These are great sources of fats as too, which we do need to burn fat and build muscle as well. So you're going to want to be very use discretion and really get quality organic meats versus conventional meats. And that goes for whey as well. If you're using a protein powder, get organic grass-fed whey, not just conventional whey powder that has lots of fillers and lots of artificial sweeteners, and the whey is not organic. So these are going to be filled with toxins and antibiotics and hormones potentially. So you're going to want to steer clear of these. So you can check out drwillcole.com, set up a consultation there to really, for me to give you some good sources of clean organic protein. So I hope this answer was sufficient. I hope that you learned something. So check out drwillcole.com for more information. And if you have any questions, go on our Facebook page. My email's on drwillcole.com. Send me a tweet, and I will possibly answer your health question.